co-hosts in the panel, Professor Dr. Wael Saad, Professor Dr. Mohamed Al-Warraqi, Professor Dr. Wahid Tantawi. Our first speaker will be Dr. Mohamed Shaker, Professor of Interventional Radiology and Head of the Interventional Radiology Department at Ain Shams University. He will talk about outcomes of TIPS in Bad Kayari in Egyptian patients.
Thank you, Professor Dr. Mohamed Gharib, dear Chairman, dear colleagues, professors. Good morning, everyone. So, talking about the outcome of TIPS in Bad Kayari syndrome in Egyptian patients. Bad Kayari syndrome is an obstruction of hepatic venous outflow, starting from the small venules up to the junction between the IVC and the right atrium. It may present with a wide spectrum of symptoms and clinical presentations, may be discovered accidentally during during routine ultrasound examination, or up to fulminant hepatic failure clinical presentation with variety of symptoms, starting by ascites in order of frequency, ascites, hepatomegaly, abdominal pain, esophageal varices, and GI bleeding. In 75% of cases, there is underlying prothrombotic disorder can be found, and although it's a benign disease, however, it's fatal within 3 years of diagnosis if left untreated. Management of Bad Kayari syndrome should be in MDT, and it needs many specialties managing this clinical condition, including interventional radiologist, hepatologist, hematologist, and liver surgeon. And all patients diagnosed with Bad Kayari syndrome should be referred to a center, specialized center, where all treatment modalities are available up to liver transplantation. This is our team in Ain Shams University, was established in 2006, including all these specialties, and our center have all modalities up to liver transplantation. Our center, we adopted the stepwise progressive therapeutic strategy for management of Bad Kayari syndrome, starting from the medical treatment and then stepping to the angioplasty, stenting, and thrombolysis, and then TIPS, and then liver transplantation. Most evidence suggests that a stepwise strategy is effective and safe if patients are followed closely, which we do, as we have a regular weekly meeting to follow up our patients and receive new patients every week. If patients are followed closely, TIPS is implemented soon after less invasive therapies yield no improvement. And TIPS is considered the cornerstone in management of Bad Kayari cases. In our center, we counseled about 900 cases till when we started till now, and about 40% of these cases managed by TIPS. The relation between TIPS and liver transplantation, when to do TIPS and liver transplantation. In most central liver transplantation is not done upfront in case of Bad Kayari syndrome, yet can be done after failure of less invasive approaches unless the patient is presented by acute severe liver failure. In this case, liver transplantation is done upfront. TIPS should be considered in symptomatic Bad Kayari syndrome patients on waiting list for liver transplantation who are not responding to less invasive measures, as it helps to decrease the dropout list. Moreover, TIPS decrease the incidence and severity of intraoperative bleeding by relieving the hepatic congestion. So surgeons always prefer to do TIPS before liver transplantation at our center. So when to do TIPS in Bad Kayari syndrome, we do in symptomatic patients refractory to medical treatment with compensated liver, when all hepatic veins are occluded, or after failure or non-feasibility of angioplasty or stenting, or as a bridge for liver transplantation in patients on the waiting list. Techniques of TIPS in Bad Kayari syndrome, the most common techniques are the classic TIPS through the transjugular approach. And in this case, we can puncture from the IVC directly. Here at the site of insertion of the right hepatic vein, we anchor our needle and then forward it toward the downward and forward toward the portal vein. However, we prefer in our center the ultrasound guided reverse TIPS technique, which we'll talk in details about it in the next talk, as it has many advantages in our point of view compared to the classic tips, creating the track under real-time ultrasound guidance, decreased radiation, decreased procedural time, and lower cost with less instruments. TIPS is proved to be effective in management of Budd-Chiari syndrome. In this systematic review and meta-analysis, the technical success rate is near to 100%. Need for liver transplantation in 6% of cases. Shunt dysfunction may occur up to 30% of cases. 5-year survival, 92%. 10-year survival, 77%. In our publication, including 118 cases, this in 2018, we achieved almost a nearby outcome using the reversed TIPS technique with technical success rate 99%, 10-year survival rate 95, 91, and 70% respectively, and 8% of our patients underwent liver transplantation. With significant improvement in the clinical outcome in terms of improvement of the symptoms, ascites, abdominal pain, upper GI bleeding, as well as significant improvement in the liver stats, including the liver function, child and MELD score. Stent patency at 1 year, about 70%, and we do recanalization of the stent mainly in 80% of cases by angioplasty without stenting, and about 20% of cases angioplasty with stenting. We follow up these patients regularly, keeping them on anticoagulants with INR not less than 2 and not more than 3. And we follow up by the duplex ultrasonography, and if there is any suspected malfunction of the stent, we do CT portography. And then we can manage usually you manage these patients by just balloon maceration of the thrombus inside the stent, as we see here, and this is the balloon maceration, and just after with complete recanalization, disappearance of the related varices. Our complication rate, bleeding occurred in 8% of cases. It was significant, necessitating surgical intervention in 3% of cases. Sepsis occurred in 9% of cases, different types of sepsis. Hepatic encephalopathy in 2% only of cases, and this reflects the compensated liver functions in these cases. They are mostly present to us before the stage of liver cirrhosis, and third is mortality about 3%. Our take-home messages: TIPS is a cornerstone treatment of Budd-Chiari syndrome with excellent liver transplantation-free survival rates. TIPS can be used as a bridge for liver transplantation, and when done before liver transplantation, it improves success rate, decreases the incidence of complications, and enhances the clinical outcome. Ultrasound-guided reverse TIPS technique shows excellent technical and clinical success rate and has many advantages compared to the classic TIPS, including less time, cost, and radiation. Thank you very much.
Thank you. Any questions, quick questions? Leave the questions to the end. Okay. So next speaker is, that was Mohamed Shaker from Ain Shams University, Professor Mohamed Shaker. Next is